the bloating, the gas, the constipation, being kept up all night with cramps and pain, and not being able to schedule things because you don't know what your gut is going to be doing, and just battling its small intestinal bowel overgrowth, or that's what it's being called. It is typically treated with antibiotics and a low FODMAP diet, but what your doctor does not know about SIBO is probably making you worse. I'm Juli Keene. I'm a clinical nutritionist. I've been working with complicated gut issues my entire career, which is almost 30 years, and I've seen thousands of cases of this. How many people have seen anybody get better with the antibiotic rifaximin or the generic and the low FODMAP diet and stay better? I've seen pretty much none. And the reason why is what your doctor is not telling you about SIBO, because they don't know. Most of them hear from the drug rep, here's what you do, treat them with rifaximin. Sometimes we add another antibiotic called neomycin, and then we put them on the FODMAP diet, and now there are FODMAP shakes and things that you can buy. That makes no sense. Processed foods are what got you in this situation, eating foods that are not good for your gut, and this is not doing what I know works and has worked for all of my clients, which is functional lab testing. Let's look at what your body is responding to. Let's do stool testing. Let's do the breath testing, but that just shows us that you have gas. You've got methane, you've got hydrogen. No surprise, you know you have gas. You don't need a doctor to tell you. I mean, I get treating a bacterial infection that has gotten into the small intestine with an antibiotic. I get that. But what that does is it makes fungal infections worse. So candida, boom, you're going to be so much worse. Your sugar cravings get worse. The low FODMAP diet allows a lot of those sugars, and it has since the start. There are some people that are moderating that and figuring it out, but I've been saying this for at least 10 years, and I've been treating it since before the book by Dr. Pimentel came out. What you need to do is start at the beginning. Do the right lab testing. I have a lab test evaluation that I use based on symptoms and prior history, as well as if you have lab results. I look at that, I pick the right lab tests, and then based on that, we prioritize and we go in that order. And the very first thing that needs to be addressed is your diet, because your diet is the most important thing in healing up your gut. And yes, sometimes a diet that is carnivore-like or high fat, it's very hard when you don't eat animal protein, because nobody's reacting to animal protein and fat, healthy fats. Most people are reacting to the processed carbohydrate foods that they eat every day, or just any carbohydrates by the time they have a bad infection. And know that it's not just SIBO. It's all kinds of things. It's yeast, it's Klebsiella, it's H. pylori. Your digestive enzymes aren't being made correctly because you don't have the nutrients that are precursors. It really takes a skilled practitioner, and while your GI doctor is doing their best, what they don't know is going to make your gut worse. And I have had countless people who have done 2, 3, even 4 rounds of rifaximin, adding in the neomycin, when really they've got parasites, they've got yeast, they've got so many other things, leaky gut, that need to be addressed that are not being addressed.